Health
All
and
right,
Wellness
so
Minister
we are now at
speaking as he
the Isaac
toured
Barrant Health
Princess
Centre. I'm here with
Margaret,
Member
Port
of
Barrant Health
Parliament,
Centre, Isaac
Councillor,
Barrant Health
and our
Centre.
Health Parish
Promise a
Manager.
lot of things to
And
come.
I've gone to Port Barrant before. Port Barrant, as you know, was recently refurbished. Very proud to say that it's well used and increasingly so since the refurbishing, which is what we want. We want more people to go into our primary healthcare facilities. It's a beautiful facility, fully air conditioned, more services, backup generator was just installed, new car park, really well laid out and really what a community health center in modern times should look like. And part of our refreshing of our health centers to shift the visitations from hospital to health centers. And we're actually seeing tangible evidence of that, which suggests that the policy is in fact working. We are seeing more Jamaicans going to our health centers, so that's a very good thing. Outside of that, we are at Isaac Barrant here, and this facility, as you know, was built back in 1966 by the late great Isaac Barrant, who was Member of Parliament and Minister of Agriculture, a man who came from very humble beginnings and was supported by the populace and earned himself significant votes in the general election back then, and then rose up to become a key leader in the community. Built this hospital, which is named after him, handed over to the community. Over time, it went down in terms of support, in terms of infrastructure, in terms of maintenance. As you can see behind me, it's now being well used as an important community health center with intentions of continuing to upgrade it. So we have on the cards and taking place, we're going to be upgrading the dental facility, for example, replacing chairs. We're going to be enclosing the areas that are open, putting in air conditioning units so we create a more comfortable environment for the team. We're looking at the old abandoned operating theater with the intention of putting it back into use, if for no other reason but for day surgeries, because we do have demands for that. And in terms of the building generally, there are some open spaces that we are now reoccupying for waiting areas, for doctors' quarters, so that we can offer more full service support here at this facility. The building is solid, and therefore it's really a matter of just reconfiguring and overhauling and putting in the necessary infrastructure. So it currently is being used in a very significant way. We think it can be used in a more significant way, and we're committed as a government to making it work. Again, this is all in keeping with our thrust towards the renewal of primary health care. You may recall that last year we tabled in the Parliament a primary health care renewal policy document, which looks at additional services at the health centers, refurbishing, overhauling, building more health centers. And that program is actively being pursued now, and you're seeing evidence of that in the parish of Stthomas. So I want to thank the team. It's a very good team out here. They work hard, they do what is needed to be done. Tomorrow, I should add, we're going to be having our Know Your Numbers program right here at Isaac Barrant. So that's a advertisement for tonight into tomorrow, where we intend to treat with, I am told, between 800 and 1,000 residents who will pass through these grounds to get free screening, blood pressure, blood sugar, BMI, eye testing, cholesterol testing, and all the other, the HIV and so on. It will be a fun activity here. And again, it's part of our outreach to screen. I'm going to say something that's maybe a little controversial, but nevertheless, it is the time for comparisons. The opposition leader in the Parliament, when he spoke, gave the impression that nothing is happening at the primary healthcare level, and that his government, in the unlikely event that he forms government, would be focusing on increased screening because we're not doing enough. He clearly forgot the Know Your Numbers program, which will be evident on display tomorrow, where over 1,000 people we expect to come and get screened. The government has conducted almost 300,000 screenings over the last year and a half under this program, separate and apart from what happens as a routine in our hospitals and our health centers. And we have identified persons who, based on their health profile, require follow-up. We have provided the support for follow-up, for more testing, and in some instances literally save lives, because we have had cases where a person's blood pressure was so high we had to move them from the Know Your Numbers location to a hospital for care. I've seen a few examples of that, and the same could be said for blood sugar level, where it was so out of control that those persons would likely have some sort of tragic event and end up in accident and emergency. So the Know Your Numbers program is a very credible program since it's launched. It was launched. It is active, and it is active here in Stthomas and will be on display tomorrow at Issac Barrant. And I will urge all to come out, no matter what your political persuasion, despite the fact that we're in the political season. When it comes to health, we treat everybody and we take care of everybody. We don't make any discrimination against anybody, including the opposition leader. If he's in the area, he can also pass through and get his blood sugar and blood pressure checked. But we are proud of the team, and I want to thank the team for being here. And again, this is part of my regular visitation across the parishes. Today is Stthomas stop, and I must say that the parish is working to keep abreast with the other development projects that are taking place, so that health services remain relevant and adequate to serve the people of the parish. Thank you.
Mr. Yeah. Can you update us on any future plans for this facility?
Okay, well, I just went into a couple, but I'll say it again. There's going to be a refurbishing of the building.
In terms of stepping up to a hospital state.
Right, so I'd said to you that the operating theatre that is here, we intend to refurbish that operating theatre, which will mean adding more doctors, including surgeons, whether they are working between Princess Margaret and here, however the schedule is, so that we can treat with patients here up to surgeries. We do intend to look at whether we can do some overnight stays here, right, parish manager? And so once we get into surgical procedures, emergency procedures, and some additional bed space, then it means that Issac Barrant will become a small community hospital again. And I think there's adequate reason why this should be the case. So listen out for more developments, but it has started and will continue until we get to where we want to be. All right, any other question?
I think it was a female ward. That's right. This was the maternal and child ward and stuff. Okay. So we're going to be getting this site back up and running. And so we're refurbishing basically right now. So yeah, down here really is not being used. We configure and lay out the place. We'll take it by bite. Yeah, by bite. Right. Yeah, and that's why when you are was one that means agriculture. Oh, you from here, Hey! They might rename one. If you have a Princess Margaret, you can get this building is easily refurbished. And especially here for the enclosures and stuff. It's very easy. Yeah. How many people you expect here tomorrow?
This is a tea that
delivered.
Dr. Maria told me her strategy today. Tell Dr. Doc how much you've already committed. How you've committed first.
We just like partner with church and with schools, and we just give them a number.
I agree.
Planning and we just give it to the salary.
So all I'm going to do is clean this up, and then we can look at maybe some day surgeries up here. Okay, you put the day surgeries here, you see.
And then we actually build it out and have offices along the side, so the surgeons have their rooms that they can sit down and review patients.
So all this was
Our inspectorate is here.
Hi, how are you? I give you the AC to right? Alright, we're gonna sort it, Don't worry.
doing that. We're really deeper. We're making our costs.
Hey, your government, has created Second Chance Smile, New Live, New Life, Jamaica Moves, Compassionate Care, peer branding programs, what you have to say about that?
I love my government.
You love it?
I love my minister. He believes in us.
I like to hear when people refer to the brand. Second Chance.
Yes, I love him.
Yeah, two cheers in here.
So we have 3 years.
What is it that you need here now?
But it's not working.
Need an X-ray.
This is not working.
So we're facing this unit because it's
Okay.
not working, and and the beautiful thing about it is that the people don't have to come all the way to Birmingham.
Right.
This year, though, isn't it?
So we can expect a new and refurbished dental facility.
Right.
Okay, fair enough. And your dentist here is a champion of that, right?
Right. Big support.
Hey.
Thank you.
Gotta smile.
All right. What are you gonna do that?
So we're gonna we lock it out because of how expensive the equipment is. Cases for Princess Margaret, like the minor cases. So even for the other parishes,
What do you offer here?
personally we offer curative services, family health services, including immunization, antenatal, postnatal, pap smears. We do oral health services here. We have a nice dental facility here. We have our environmental health team here. Malaria was like a problem back in the old time days because of the swamps that surround here, but we've been managing to control the mosquito. They're not for these. We thank you for those vehicles we got in 2020 about there. We got 4 vehicles and we were able to put the ULV machines on them. So it's a combined effort and we're grateful for that. But I came here first. No, what's half of our so our own hospital, so we just use the front of it and we convert it to some of the wards into clinic space. And we also have our special diabetic retinopathy screen here. So Casey I think has 1, we have 1 and St. Catherine. Services. The doctor's offices are on the side of it. So this is actually the only time was a hospital. We added this room to it to be this one.
It's really helpful. Oh.
And like, only way we have to be the spaces outside where you have spaces. We take it as a